On this week's episode, Dr. Rob and I talk about how deep tissue laser therapy can speed up the healing process for virtually any muscle injury. Dr. Rob. We've highlighted laser therapy before in other episodes, but this week we're going to just talk specifically only about laser therapy. So Dr. Rob, tell me, how does laser therapy work?
The first thing it does, when you use the light stimulates the part of the cell that creates energy, so it just starts to get the cell to really start healing when you do that. But there's also a really powerful anti-inflammatory effect, so any swelling in the area, it can be helpful with that as well.
So I guess in regards to runners, how specifically could it help somebody? I'm thinking athletes in general.
With runners, most commonly what we'll see is like some calf strains just from overtraining. We have a couple of people we're working with calves, and we're working with their hamstrings. They're training for like distance runs, and after about like 10 miles, they say it really starts to give them problems. But with doing this, it seems like we've kept a lot of that soreness away.
So keeping down the lower extremity, what about feet, like plantar fasciitis?
We do a lot with that. We'll usually work on the calves as well as the bottom of the feet, and same kind of thing. We're trying to break up some scar tissue, get some more energy into the cells, and have an anti-inflammatory effect with it.
Okay. What about weightlifters?
Usually we'll see more upper body types of things. So we're working with now, training for a strongman competition. He does a lot of like 500-pound like holds with these stones, and his elbows get pretty beat up during that, so we've been working a lot with that.
Yeah. So elbow tendonitis
kinds of issues, but also like making sure we're keeping the shoulders loose. Same kind of a thing, just to not overwork anything else.
What about just a regular, everyday person with like back pain?
We use it because we primarily see a lot of like neck pain, back pain, things like that, and it's really helpful for loosening a lot of the muscles. Again, some people have had like low back surgery, so trying to break the scar tissue in the area so that we can just get normal joint motion back in.
So with a chiropractic adjustment, is it really a pairing, I guess, with that therapy?
Yeah, I think so. I think it's a little more effective than like using the E-stim pads or things like that. I think you can break up the muscle a little bit more.
Yeah, in regards to a specific time frame on treatment, does it depend person to person?
Depends on person to person.
Yeah, but it's not just a one-time treatment?
Not usually, but at the same time, acute injuries, they do respond pretty quickly to the laser. So it's not like we have to use it every single time.
So in specific, one session takes how long?
It's usually 3 to 5 minutes, depending on like the site of injury. No, it's really not.
And there's no heat involved?
You will feel a little bit of like warmth, but it's not like, oh, this is hot, this is burning, or anything like that. You just kind of keep moving the head so that you don't get that much heat in the area.
What about post-surgery?
Post-surgery is good. Again, there's a lot of scar tissue that's formed, so breaking that up as much as possible is going to lead to more healing.
I know specifically you've had surgery done on your wrist. Yeah. Have you seen a lot of
I saw more improvement when I was using a lot more on my hip. Haven't been able to do as much work with this one yet, but starting to see a lot of that scarring loosen up.
Yeah. All right. Well, coming up next, we're actually going to show you how the laser specifically works. Rainy's Fitbit is up next.
Hi, I'm Rainy. Welcome to the Fitbit of the Week. Today, I want to go over how important water really is for your body. Because the average human body is actually made up of 75% water. And I've broken it down here into different components of your body and how much of them is actually water. So for your brain, it's about 75% water. Blood is 92% water. Your bones are about 22% water, and muscles are about 75% water. So you can see that as much water as is in these components, water really is important for your body and making it function correctly. So what is recommended is that you drink about half of your body weight in ounces per day. And it is really important to get all of those ounces each day, because as little as 2% drop in your water levels can actually trigger your signs and symptoms of dehydration. And those may be something, like fatigue, or maybe just feeling thirsty, maybe even feeling hungry. Sometimes hunger can actually be a symptom of being dehydrated, or it can be something more major like having a fuzzy memory, or not being able to concentrate as well. So if you do tend to feel those more often, it's probably a good idea to see how much water you're drinking and try to focus on getting that, all of those ounces per day. So also on this board, I've kind of laid out different areas of the body that can be affected by water, and different topics, I guess, that are things that may be caused by being dehydrated. So there's a few, it kind of goes from head to toe, various areas here. So we're going to start here: digestive disorders, high cholesterol, weight gain, joint pain and stiffness, bladder and kidney problems, premature aging, constipation, skin disorders, asthma and allergies, high blood pressure, and then also fatigue, as I mentioned before. So if you are maybe having issues with any of those topics, we are putting what I have here on the board, we're going to put an infographic on the Facebook page and also on the blog. So if you want to go and check that out, maybe read more about it and see if getting the correct amount of water into your body may help those issues that you're already having. So that's been this week's Fitbit, and we'll see you next time.
So what we're gonna do laser on Dr. Mike's knee here, and what we would usually do is we're gonna go all around the joint. I would probably work a little higher into his quad, but I don't think he can get the dress pants up any higher than that. So really just gonna kind of surround everything around the joint. Anywhere that's really sore, we're gonna spend a little bit more time there and focus there. For today, we're gonna say inside of his knee's been hurting, maybe he has an MCL sprain, something like that. So we'll spend a little bit more time in that area, kind of going back and forth in different directions. But I'm gonna have you go ahead and bend the knee. And we're gonna wanna move it a couple of different ways just so we can get to different areas of the joint. At the same time, like if we go back to the front of his leg, if we find a lot of muscle tightness in that area, we're gonna work that, because that is gonna play into knee pain as well. We'll make sure we work the entire joint, not just the area that's sore on him though. That's sore in there?
That's good.
You can even work down a little bit into the shin as well and get some different areas. Just to make sure we get everything around it. And what I'd normally do, I'm going to have you flip over face down because I want to get back to these too. And from here you can kind of get into a lot more of the soft tissue. You are going to find more back here, and sometimes it can be a little bit more painful on people, but it's an important spot to get loosened up.
That's right there.
One thing to keep in mind is after we do laser on somebody, we don't want them to do ice for about 3.5 hours afterwards, because that can cut down some of the effect of the laser, because you're not going to get as much blood flow back to the area.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.